The president's speech was his most detailed and specific yet about what he would support in a health care bill. But is everything he claimed about the benefits of his health care reform plan supported by the facts? We asked our White House correspondent, Jake Tapper, to give the speech a fact check.
The president tried to do a fact check of his own.
The reforms I'm proposing would not apply to those who are here illegally.
Would the president's reforms apply to illegal immigrants? The answer is no. House and Senate bills explicitly say any new government subsidies to purchase health insurance would only apply to legal citizens. But the issue is more complicated than that. When illegal immigrants go to emergency rooms, the charges are often paid for by emergency Medicaid, which at least one Democratic bill may expand. Though today the White House reiterated the president's point.
The legislation that the president will sign won't cover illegal immigrants.
What about this claim?
And insurance companies will be required to cover, with no extra charge, routine checkups and preventive care. That makes sense, it saves money, and it saves lives.
Does preventive care save money? Some experts say the answer is no. Preventive care is humane, smart, and moral, but the director of the nonpartisan Congressional Budget Office says, quote, the evidence suggests that for most preventive services, expanded utilization leads to higher, not lower, medical spending overall. One of the problems for the president's pledges last night is that the legislation drafted and made public so far by Democrats in Congress has yet to live up to his promises.
I will not sign it if it adds one dime to the deficit, now or in the future, period.
A nonpartisan analysis of the House legislation said the bill would, quote, result in a net increase in the federal budget deficit of $239 billion over the 2010 to 2019 period.
It will slow the growth of health care costs for our families, our businesses, and our government.
Again, the White House insists the bill the president signs will achieve that, but the Congressional Budget Office said one Senate bill will expand costs.
And Charlie, apparently tired of defending legislation that does not meet the president's goals, last night the White House posted on its website a 2.5-page Obama plan for health care reform. Broad outlines, no details. They say the devil's in the details. Well, the fewer details, the fewer devils.